Hi, everyone. Welcome to the Gut Reset Summit. I'm your host, Dr. John Dempster, and I'm thrilled to be joined today by Dr. Elisa Song. Now, Dr. Song is an integrative pediatrician, pediatric functional medicine expert, and the mom to two thriving children. In her integrative pediatric practice, which is in San Francisco, it's called Whole Family Wellness. She's helped thousands of kids get to the root causes of their health concerns and help their parents understand how to help their children thrive via body, mind, and spirit by integrating conventional pediatrics with functional medicine, homeopathy, acupuncture, herbal medicine, and essential oils. And Dr. Song created Healthy Kids, Happy Kids as an online holistic pediatric resource to help practitioners and parents bridge that gap between conventional and integrative pediatrics with an evidence-based, pediatrician-backed approach. So welcome, Dr. Song. Great to have you here today. Tell us a bit about how you got into this niche.
It's interesting. I actually was not intending to be a pediatrician at all. I mean, I always loved working with children, and I was going to be a children's rights advocate, do public policy, and go to law school. And I kind of stumbled upon in my undergraduate years at Stanford a long time ago a flyer for the Medical Holistic Association. American Holistic Medical Association, which it doesn't exist anymore. But, as a junior, I'm like, what is that? So I actually went to this conference as an undergrad, and this was in the 80s, and there were folks who were just starting to get known in the holistic world. So Andrew Weil, Deepak Chopra, Joan Borisenko. And I mean, my mind was blown, actually. I was like, oh my gosh, I called my mom, who's an OBGYN, and I said, Mom, I think I might want to be a naturopathic doctor. And I actually got an application from Bastyr, but back in that day, I mean, really, none of my family or friends or relative, my mom, I mean, they fully supported what I wanted to do, but they weren't sure if what that was. And now we know. I mean, naturopathy is so amazing, but that kind of informed. I thought, okay, maybe I'll be a pediatrician because I love kids and I want to work with kids. And so it's always been a passion of mine. And I knew from the beginning when I started my practice that it would be in this integrative way.
I love it. Well, it's such a good story. And I know we're going to talk about kids today. This summit's all about gut health, but we don't talk a lot about the gut health in our children enough. I'm proud father of three young kids. And so I'm, very, very intrigued by what we're going to talk about, how to heal leaky gut in children. And I know that's a big focus of what you do in your practice. And so listen, tell us what's going on. Why do we have to pay attention to leaky gut in our kids? Are they getting sicker? Are we seeing any changes that should flag this?
Well, we know that kids are getting sicker. We know that the rise in chronic disease in adults is being mirrored and even more exaggerated in children. The pandemic shined a glaring light on the crisis of pediatric and adolescent mental health, and that is really only worsening, unfortunately, with visits to the ER for, suicide attempts in young kids. By the time kids are 18, nearly 1 in 2 is going to be diagnosed with some sort of a mental health disorder. And autoimmunity. I mean, we know autoimmunity is skyrocketing in adults, and then we have in our children. There was a study that measured something called an ANA, which for the audience is an anti-nuclear antibody, very general autoimmune marker in your blood, which doesn't necessarily mean you have an autoimmune disease yet, but it's a red flag saying, hey, you better pay attention. So they followed these ANA markers in different age groups through the decades from the 1980s on, and they found every single age group actually had a rise in positive ANA, but the rise was most significant and rapid in the 12 to 18-year-old age group. I mean, doubling and tripling in rates of positive ANA. And so what does that have to do with the gut? Well, we know that a baby's developing gut microbiome from even preconception, and birth and beyond informs how their immune system develops and how their brain develops. And so the foundations are so important. And we are now really understanding, and there's been an explosion of research on microbiome health in adults, and we're slowly getting there. Unfortunately, children's research, pediatric research always lags behind adult research. And, kids are not little adults. I mean, they have their very own microbiomes and their very own, path of development. And so what parents should understand is the developing gut microbiome in an infant looks very different from about, birth to about 2.5 years, 3 years of age, than a more adult-like pattern. And it is in that window from 2.5 to 3 years of age where the gut communicates with the immune system. Over 70% of our immune system lies in our gut, and informs our immune system, hey, how are you going to react to, X, Y, and Z, whether it's a food or a pollen or an environmental toxin or an infection? Are you going to react in a healthy, balanced way? Are you going to react too much and have persistent chronic inflammation? Or maybe react in the wrong way, inappropriate way, and have autoimmunity. So that's very important. And then the gut brain connection. I mean,
Mhm.
that's even more fascinating to me. This explosion of the change in the gut microbiome in those first 2 years of life is mirrored by this rapid explosion of neurons and synapses, these brain connections in infants and toddlers' brains. And now we're recognizing that it's actually the gut microbiome that informs more of that brain synaptic development, and with the recognition that the vast majority of many of our neurotransmitters, what we thought of as brain chemicals, are really made by our gut, like serotonin, our feel good, relaxing neurotransmitter that's implicated in anxiety and depression and other mood disorders that are so common in our kids. So yes, the gut microbiome, all I mean, Hippocrates says all disease starts in the gut, but we really need to think all health starts in the gut. So how do we support that for our kids?
We talk a lot about healing leaky gut in terms of the adult context, like you mentioned earlier. And even on this summit, I've interviewed a number of wonderful experts to discuss how do we heal leaky gut as adults. But what makes it different with children? Like, what strategies are we going to start to look at to cater this towards our pediatric patients, whether we be a practitioner or a parent?
Yeah, that's a great question. And, of course, many functionally medicine trained practitioners know the 5 R's. And, when I trained in functional medicine, this is back in, you know, almost, almost 20 years ago, it's 2004. I'm dating myself, but it was called the 4 R's. So if you were around back then, it was a 4 R program to heal leaky gut, which was the repair the leaky gut lining, remove any dysbiotic organisms or anything inflammatory to the gut, re-inoculate the gut with the good bugs, and then replace anything that's missing, like digestive enzymes or gut healing nutrients. Well, that 5th R was added somewhere along the way, and that 5th R, especially for our children, is really and truly what I believe is the most important R. And that 5th R is restoring that gut brain, gut mind connection. And so for children who really face a lifetime of forces that are disruptive to the gut microbiome and to the gut lining, it's not just about trying to plug the holes and do a one-off fix. It's really about building that underlying gut microbiome resilience so that no matter what comes your way, whatever gut microbiome disruptors, and there are plenty in our modern world, whatever comes their way, they can bounce back. And of course, we do the 5 R's, as needed. But that 5th R is going to be the key to that resilient gut microbiome. And that 5th R really stems from supporting and harnessing the healing powers of the vagus nerve. Now, the vagus nerve, as many of the listeners are familiar with, and I'm sure other speakers have spoken about it on the summit, is that informational superhighway between your brain and your gut. But what most people don't realize is that, 80% at least of the communication occurs from the gut microbiome to the brain, not vice versa. And how our gut microbiome is shaped and performs and functions regulates our children's brains and behaviors and moods, even IQ on some level. And then also how we perceive stress affects how our microbiome functions.
I'm so glad you're touching on this because, the last 3 years globally, I think all of our vagus nerves have taken a massive hit. We can only
Oh,
imagine what it's done to our children. And so how do we teach our kids, or what techniques are you using to engage that vagus nerve right now?
Oh, I love talking about this because now, as you said, I mean, especially during the pandemic and with the social isolation and just the fear, right? I mean, it's like it feels like a lifetime ago, and it's hard to imagine it was really, three and a half years ago, three and a half short years, and for families where their children were young and maybe born during that time or toddlers. I mean,
We had one start and birth in COVID. we,
yeah, I mean,
we
what
all
a
of
time. I mean, right. And so, we are so used to every day living in a heightened state of alert and alarm. And that's just become normal for us to be in this fight or flight state. And it's become such a part of our life that we don't even recognize it often. We don't recognize that we're in this state of alert, expecting the worst thing to happen, trying to move from this or that, leading, in the beginning of the pandemic, there were some silver linings where we were forced to slow down,
them.
right? I mean, I was not seeing patients in the office for a little while. People were able to spend more time with their family, having family meals, going on walks, but that quickly, I mean, I just thought, oh my gosh, if that could last, but of course things don't last like that. And so when we're in the state of alert and alarm, that's the sympathetic nervous system putting us in that fight, flight, or freeze response. And children, many, many children live in this day in and day out and don't have the tools to get back into that calm state where our gut can repair, our brain can repair, our immune system can repair. And that's the role of the parasympathetic nervous system. When we engage our vagus nerve, we get into that healing state. And so because our sympathetic nervous system, those muscles are being worked out all the time, and our parasympathetic is not being worked out enough, we need to really every day focus on practicing some vagus nerve work. And we want to do it in a fun way. I mean, I'm not expecting kids to take a yoga class for an hour or sit and meditate for half an hour. Some will. I mean, some will, but not it's a harder sell. And so there are a few things that we just want to incorporate in our daily lives that engage our vagus nerve. And when we engage our vagus nerve, and I like to put it in more concrete terms so that parents and children know this is not just, some woo woo, I'm going to relax and close my eyes and listen to Zen music when I have the time. This is really, as much of a medicine as anything else, any supplement we can recommend, any prescription we can prescribe, any dietary change, that we can propose. So when we engage our vagus nerve, something called our heart rate variability improves. And heart rate variability is really one of the most important biomarkers for current and future health. It can be predictive of poor health outcomes. And it's something that, for adults, a lot of adults wear Oura rings that can track your heart rate variability. But even for children's heart rate variability should be even larger than for adults. And so anything that we do that engages our vagus nerve also improves heart rate variability. And the fascinating thing with improving heart rate variability is that improving heart rate variability will improve your gut microbiome diversity and function independent of diet. And I'd love to tell parents that because sometimes, as we're talking about diet, they're like, there's no way my kid is so picky that I can change their diet right now. So then don't. I mean, yes, we want to move towards that, but focus on vagus nerve work because that's going to make a huge difference.
I love you just brought up HRV because this is one of the buzzword biomarkers that we can measure through wearables, such as the Oura Ring, Whoop, whatever it might be. Now, I'm curious to know. I'd love to hear your opinion on what those numbers should be aiming for anyone who is listening today that has any of these wearables. Have a look at your HRV, and then Dr. Song, give us some ideas of what we should be striving for in our kids and maybe even quickly in adults as well.
Yeah, the fascinating thing is, we're all, we all like to compare and see where we're at. And the thing with HRV, and first of all, there's not, unfortunately, a great device for children to measure HRV. I've contacted Aura, and they won't claim that their markers can be used and relevant for children, although I think that there is a role there. And my children are sort of preteens. And so, definitely and they're, kind of big, almost adult size. Well, they are adult size preteens. And so I think that it could be appropriate. The thing with heart rate variability is that it's really unique to the individual. So it's more knowing what your normal or optimal heart rate variability is, because some folks will have quite a large range and sometimes even reach, 90 beats per minute or over 100. I mean, I had one kiddo who at points in the night, I was a teenager and I would look at his Aura Ring scores and 130. What we do know is that there's a minimum though, right? And so, and that children really, I'm not going to, the numbers aren't going to be precise, but children should have probably at least 40, in terms of the heart rate variability. We know that adults, if you go under 10, that's not a healthy sign. Right. And so we really want to strive for more than that. And then it's the reason why the Aura takes a while to really assess your own heart rate variability is because it takes a while to know you as an individual. And the beauty of knowing what your heart rate variability is and tracking it is so that you can see how you can intervene and improve it. Because we can. There's so many things we can do to improve it. There are things that can harm it, like, drinking alcohol too late at night or, pulling some, all-nighters for finals week or whatever it is, right? But one of the best ways to improve it is going to be with mindfulness meditation tools that, for kids, we can use some really simple tools to engage their vagus nerve every day. And it's just about making it an everyday, on your walk to school, you can practice it, right? And so, so we just want to make that a normal part of their lives to stop for a moment and engage their vagus nerves, get their heart rate variability improved, and then sustained, hopefully, throughout their day.
Yeah, it's so smart and so important. You mentioned it earlier. When you measure things, you can get tangible information. We say when you test, you don't guess. So this is just one marker of many things that we can be looking at. But I know the technology's just getting going. And it's going to continue to improve. So we'll probably find a way to find a suitable way for our children to track some of these numbers too at some point. I'm hoping, anyways.
Yeah.
So what are some of the more common? I want to come back to the leaky gut. I want to get right into that sort of aspect of the microbiome here. What are some of these signs that parents who are listening right now can start to look for when the microbiome of their child is starting to drift in a way that we don't want?
Mm. So, so many, right?
Yeah.
Virtually any persistent or chronic pediatric health problem, just like for adults, um, can be correlated with some element of gut dysregulation, whether it's gut dysbiosis, an abnormal balance of bacteria, yeast, viruses, or parasites in your gut, and also leaky gut. And the two tend to go hand in hand. Now, you may not have dysbiosis and just have the leaky gut, or vice versa. But the reason why dysbiosis and leaky gut, the combination, is of such importance to understand is because when you have especially these gram-negative dysbiotic organisms like Klebsiella or Citrobacter or Proteus. These are the ones that we also know can be more correlated with autoimmunity in general. And so these gram-negative bacteria from their outer membranes have something called LPS or lipopolysaccharides. And when you have a leaky gut, that LPS gets absorbed into the bloodstream through the leaky gut lining and causes something called endotoxemia. And endotoxemia, we know is we've seen, through COVID that, endotoxemia, metabolic endotoxemia, elevations in LPS are correlated with sepsis risk. But we also see in pediatric conditions that LPS can be correlated with lots and lots of brain and mental health and neuropsychiatric conditions. In fact, what's fascinating is, LPS can be elevated more than control populations in conditions like pediatric OCD or ADHD and PANS and PANDAS, which is an autoimmune neuropsychiatric condition in children. And then there is a protein called zonulin that can get released when you have a leaky gut lining. And zonulin also can get absorbed into your bloodstream through a leaky gut. And they found zonulin is increased in conditions like eczema and asthma in children. And ADHD, what's fascinating is they found that in this one study, the higher the zonulin levels, the worse the ADHD symptoms in the child. So essentially, the leakier the gut, the worse your child's symptoms. And so really, when we think about a leaky gut and we think about the connections between your child's gut immune system and their gut and their brain and their gut and even how their genes express themselves or epigenetics, we can see why leaky gut in children can manifest in yes, gut symptoms, but so much more than that. So any mental health concern, anxiety, depression, OCD, anxiety, ADHD, autism, any immune concern, whether it's frequent infections or autoimmunity or eczema and asthma and hay fever. In fact, disruption to the gut microbiome has been found to significantly increase. Well, let's roll back and say, well, what are the biggest factors for disruption to the gut microbiome in kids? And honestly, the number one is antibiotic use. And unfortunately, I mean, yes, antibiotics can be life-saving. And I definitely have prescribed antibiotics to children. However, we know that in some studies, it's been shown that up to 70% of antibiotics prescribed to children are inappropriately prescribed, often for viral infections like a cold or a flu that antibiotics are going to do nothing for, or like too broad spectrum, then too strong an antibiotic for the indication. And antibiotics don't care what microbes they kill. And some antibiotics have actually been shown to preferentially kill the probiotics, the good bugs in your gut, and retain things like Clostridia and Klebsiella and the bad bugs that you don't want to keep. And so one study looked at almost 800,000 children in the first 6 months of life who were given either antibiotics or antacid medications, which could also disrupt the gut microbiome, and found a significantly increased risk, double to even quadruple the risk of every single allergic disease in those children by the time they were 4 years of age. So I'm talking anaphylactic food allergies, eczema, asthma, hay fever, hives. Another study found that antibiotics in your toddler years could almost double your risk of mental health concerns by the time your kids were older or in their teenage years. So we just need to understand this and not, for parents, I always say parents who are listening right now and their kids have concerns like asthma or eczema or anxiety. And you're like, oh my gosh, my kid got antibiotics, 5 times when they were under 2. We start where we're at. And we can heal the leaky gut, right? Otherwise you wouldn't be doing the summit, Dr. Dempster, right? I mean, we wouldn't be doing this work. And so we can heal from where you're starting from. But the key is, and I'm so glad you're doing the summit, because the key is to know that there's a problem to begin with that we can address.
You and I both understand that there's a time and a place for antibiotics, and I'm really glad you touched on this. We can list off the reasons why you should consider them, but what do you do once you've prescribed an antibiotic for your pediatric patients? What we hear a lot about probiotics and prebiotics and so forth. Is there a certain, for the parents out there right now that want to take some action, they might have had some recent exposure. What do you recommend for that? Is there a certain dose, certain strain?
I'd love that you asked that because more isn't always better in terms of probiotic strains, right? I mean, in our in our society, we tend to think, more is better, and we want 100 billion colonies, 450 billion colonies, 900 billion colonies, CFUs, colony forming units of probiotic strains. What we also know is that of the 100 trillion microbes in our gut, we're just on the tip of the iceberg of understanding which probiotic strains benefit what conditions. And there are particular strains that have been studied to be able to restore a disrupted gut microbiome. So, those are, and that research is changing, but some of the strains, like there are, it used to be DuPont, but they are now called IFF, but they have 4 probiotic strains. They're called the How Are You Restore strains. And yeah, those strains have been shown to help support and restore a disrupted gut microbiome after things like antibiotics. There are certain spore-forming bacteria like Bacillus, believe it's the HU58 strain, that also has been found to be beneficial in restoring gut microbiome. Saccharomyces boulardii is helpful in reducing, gut dysbiosis, yeast, especially yeast dysbiosis after antibiotics. So trying to choose strains that are supportive of that. Now, as a consumer, you're like, well, what does that mean? How do I choose? It can be challenging. And so for now, the best we have in terms of probiotics is really trying to choose one that has many strains in it, just multiple strains, ideally strains that are, when you go to the manufacturer's website, that it will say which specific strains are in there. And I'm not just talking about, say Lactobacillus rhamnosus, but Lactobacillus rhamnosus GG is the strain-specific probiotic. So that would be beneficial, as many different strains as possible. I mean, typically when I'm using probiotics, I will aim after antibiotics. I do usually go up a little bit on the amount because I want them to stick. So maybe for kids, 25 to 50 billion colonies. Older kids, I might do 50 to 100 billion colonies. But here's the thing, probiotics aren't going to stick without something to feed on. Right. So they need prebiotics. And so many of these probiotics will have prebiotics in them. I am a fan of really getting as many of your prebiotics and also even your probiotic strains from foods, though. There's nothing that's going to be more restorative to your gut microbiome than going back to food as medicine. And so I get, when you have that leaky gut and when you have the antibiotics, yes, we do the supplements because sometimes we're not getting enough from our diet, and especially for children, they may not be loving fermented foods rich in probiotics and postbiotics, right? So we give them a probiotic supplement, and they may not have a fiber-filled, plant-based 30 plants per week diet to support their gut microbiome. But really, you're not going to get as much bang for your microbiome buck, with a supplement than you are if you can get those prebiotics in from fiber, and legumes, if you can tolerate, colorful fruits and vegetables. All those phytonutrients help support a healthy gut microbiome. And fermented foods really are going to be, more powerful than anything else. If you tolerate, again, if you have chronic health issues, sometimes the histamine load is a little bit of an issue. But there's the probiotics, there's the prebiotics. And then the gut supporting nutrients to heal that leaky gut lining, because antibiotics also have been shown to directly cause leaky gut too. Not all of them, but some of them. And so we have this kind of double whammy with antibiotics where we have the dysbiosis, right? Killing off of the good stuff, keeping some of the bad stuff in, and also triggering leaky gut. So now we have this double whammy. And so we restore the gut microbiome. And then we also want to repair the gut lining with things like zinc. Zinc is one of the most common nutrient deficiencies in children. So most children are going to benefit from zinc, but throw in your pumpkin seeds into your smoothies, and get in more poultry in your diet, and other nuts and seeds, zinc-rich foods. We need glutamine to heal the gut lining. We need our omega-3, so fish oils. Eat some fatty fish. So those are probably the 3 parts. And I love quercetin as a gut healing nutrient. Quercetin is a natural mast cell stabilizer that can reduce histamine excess, but it's a great antioxidant for the gut lining. And so that can be from foods like, red apples, purple grapes, raw red onions, but you can also get quercetin as a supplement.
Great. Those are huge, powerful things that parents right now can apply, put in the pantry at home. And so listen, we touched on a couple of these triggers for leaky gut. There's so many. But in children, we touched on the stress, we touched on antibiotics. What are some other common triggers that we can be looking out for?
I would really look to the food that your kids may be eating. Even food that, it's one thing to, yes, we know ultra processed foods are not good for anybody, but sometimes we're buying foods that we think on the label say healthy, and fiber rich, or whatever it is, organic, and they're not necessarily. So really looking to the foods that might be disrupting your child's gut microbiome. And I'm talking processed foods, but there's a spectrum of processed. I mean, ultra processed, with anything that says artificial, artificial dyes, colors, 50 gazillion ingredients on the list. I don't want kids buying those. I don't want parents buying those. And I educate kids on how to read the labels now that my kids are older. And we'll go to the store. And the other day they asked, "Oh, can we have a drink from one of the drink refrigerators where there's iced teas and there's kombucha and there's, whatever else?" I said, "Well, you find me a label that looks like something that you should put into your body, and then we'll look at it together." Because I want them to learn how to do this when they're out of the home on their own, choosing for themselves. But there are what I call microbiome mischief makers in our food. And, for our parents where kids may be a little more selective. And like I said, sometimes getting in phytonutrients, more fiber, fermented foods, those can seem more daunting. So then we think about, well, what are some of the things that we can do to nourish our gut that might just be making these swaps and removing some of the things from our packaged foods? Number one are emulsifiers in our packaged foods. Well, I shouldn't say that. I mean, anything that says artificial, like I said, just put it back, right? But emulsifiers are they're FDA approved food additives that keep your food together. They emulsify, and they keep your ice cream from being goopy mess when you open it up, or maybe like a protein bar. They keep it from becoming this slime in the package, right? And so you're not going to see on the package emulsifier. You're going to see things like mono and diglycerides, or carrageenan, or even xanthan gum, right? Which there may be some benefit of the gums, like guar gum. They can act as prebiotics, but many, especially mono and diglycerides and carrageenan, have been found to have a direct harmful impact on our gut microbiome. So they can contribute to leaky gut, to contribute to gut dysbiosis. And in some countries, they found that the rise in the use of these emulsifiers in their food industry has been correlated with a rise in autoimmunity in those countries. So being aware, and you just don't know until you look at the ingredients. And so, as we were, my kids and I were looking to see, oh, we were supposed to bring dessert to a friend's house. Let's bring some ice cream. And so we were looking at the ice creams, and we saw, okay, there were many that have mono and diglycerides listed on the label, right? But there also are many that have heavy cream, sugar, some fruit, and that's it. And so, you just by making those simple swaps, we can go a really long way in supporting our children's gut microbiome now and also into the future as they start making their own choices. So, so that's really important. And then the psychological stress, I will say, we think about antibiotics as the biggest acute disruptor to the gut microbiome. Psychological stress is the single biggest chronic disruptor. So that is really important to understand. And as we think about how to support our children's vagus nerves, that is a priority. I mean, lifelong priority. So, that would be something really important to add in as we think about how do we nourish our gut microbiome. It's about what they're eating or what they're not eating. It's also about how they're engaging their vagus nerve.
Yeah, those are great. Yeah, thank you for sharing that. I think you made me think, as soon as something has a label on it, we're already one step behind from a food standpoint, right? So if we're making our own meals, buying the produce, buying the real food, so to speak, you don't have to read a label for those things. But listen, we're in the reality we're in right now. Labels are going to be there, and I love that you're teaching your kids how to read them. I think that's a very powerful tool.
I mean, and the reality is when your kids are little, you don't have to worry about that because, I mean, they're eating everything at home. But as soon as they go to school
Not
and they
not
see,
everything, Dr. Lisa, but, I'm hoping to improve that.
yeah.
Is there any particular diet, we hear all about these labeled diets out there, paleo, keto, whatever it might be, gluten-free. Is there any one diet that you tend to subscribe to help children heal their leaky gut? And I know it does vary child to child, but is there any core principles other than what we've touched on already today?
You know, um, Not necessarily. I mean, I don't really, I don't want kids and parents to feel more and more restricted in what they're doing.
So
Um,
important.
and when we go on elimination diets, I mean, the first thing to look at, because kids are going to need to be on a clean diet, a cleaner diet, to heal their leaky gut. And so, just taking out the things that are really inflammatory. When you're healing leaky gut, I gluten and dairy elimination can be very, very important. And because, gluten by itself has been found to increase zonulin and trigger leaky gut, so inflammatory, even if you don't have celiac disease. And same thing with the casein in dairy. They're really inflammatory. So I do want parents, while they're healing their children's leaky gut, to be on a gluten-free, dairy-free diet. And then with that, it's more about what you can get in than what you're removing, really, on a certain level. I mean, if your kids are living on, French fries and In-N-Out burgers and prime energy drinks, that has to we need to shift away from that. But whenever I start an elimination diet, I always first add in foods that your child can eat. It's not a race. So you don't have to go on an elimination diet, the next day. For an adult, it's relatively easy to do. We can just say, okay, I'm going to clean out the pantry. Just going to do it. And I'm just going to muster through. We don't want that for kids. We don't want this to be drudgery or a battle between mom, parents, dad, and kids, whomever it is. We want kids to feel empowered and joyful that they're doing something that is helping them feel better, feel good. And so, working in, if you're trying to get in gut friendly foods, get those to be a regular part of the diet. If you're doing gluten free, find a few different gluten free pastas and breads and, whole grains that your kids will enjoy and can be part of the diet before you take away all the gluten. Do the same thing for dairy. And really, really focus on what your child can eat, because that's what we want for our kids. Wow, look at all the other things I can eat. Look at all the things that I'm eating now. Even though gluten and dairy are not in my diet, look at all the amazing things that I do have to eat. So, I mean, that, and it might take a little while to get there, but that's okay. Like I said, this is for a lifetime of health. It's not a sprint. So we just want to ease into it.
Dr. Song, we touched on a lot of really key and important points today. Are there any other aspects to healing leaky gut in children that you'd love to touch on before we call it a wrap today?
Yeah. So I would love to share just a couple of different vagus nerve kind of, heart rate variability improving exercises that you can do at any time. One of my favorite ones, it's a play on the five senses meditation. And I love this one because it allows you and your child to stop and engage all of your senses and improve your heart rate variability, improve how your vagus nerve is functioning. And so this you can do, I mean, whether you're sitting at the dining room table or walking on your way to school, you just stop. So I call it stop, look, and listen, because a lot of parents and kids know that from when you're crossing the street, you stop, you look, and you listen before you cross. So you stopping is just to stop and give yourself permission in that moment to take this mindful minute. And then you look, and the look is just look with all your five senses at what's going on around you. But first, we close our eyes because our visual input, our sight, is our strongest sense that we use every day. So we close our eyes, and then we just stop and we listen with our ears at what we're hearing. And we might notice that chirping bird in the tree that we hadn't noticed before. We might notice the airplane flying overhead. Then we notice what we smell. Maybe it's the fresh cut grass, or if it's the winter, it might be your neighbor's chimney, the smoke from the chimney. Then we notice what we taste. Do you taste the breakfast that you just had, or maybe the minty toothpaste that you just used? Then we notice what we feel on our skin. Maybe it's the wind blowing through your hair, or maybe it's the hard seat that you're sitting on. And then finally, we open up our eyes and we look with fresh eyes. What do we notice that we didn't notice before? Maybe you notice how bright and blue the sky is. Right. Or maybe you notice, wow, look at the lines on the flower. I noticed now that there's like all this purple and pink in there. And then the listen is then we consolidate that. We listen in that moment to how our brain and our body are feeling. And then that's it. right? It can take all 2 minutes to do, but just that ability to stop, look, and listen. And then the second one is just breathing in the right way. We know belly breathing, diaphragmatic breathing, not with your shoulders, but pretending there's a balloon in your belly, expanding that balloon when you're inhaling slowly, and then exhaling slowly as that balloon deflates, keeping your shoulders down. That absolutely engages your vagus nerve, improves heart rate variability. So we breathe like this mostly throughout the day with our shoulders. So just children and their parents, if we can take that moment to do some diaphragmatic belly breathing, that's an instant way that we engage our vagus nerve. So doing those throughout the day gives our vagus nerve practice. Doesn't have to be a 30, 60-minute yoga meditation class. It can be all the moments that we can take just throughout the day. And that's how we really engage and have our vagus nerve know how to do it.
Those are amazing. I love those. That's so helpful and so practical. I love it. Listen, where can we find you online, Dr. Song?
So the best way to find me is on my website, healthykidshappykids.com, where I have blog articles, I have resources for you. I send out a newsletter with the latest pediatric integrative and functional medicine information, typically, every other week. And then also on Instagram is where I'm the most active, where I post, some of the latest things and tips and tricks. And I'm all about practical advice. So that's at healthykids_happykids.
Thank you so much for sharing that. And thank you for sharing your wisdom today. This has been a real honor. And thanks for everything that you're doing in the space of pediatrics and health and well being.
Well, thank you for doing this.